Ankylosing spondylitis causes and symptoms. Ankylosing spondylitis is a form of arthritis that mainly affects the spine and sacroiliac joint or the lower back. An inflammatory disease. Symptoms of ankylosing spondylitis include pain, stiffness, and loss of mobility. The disease involves erosion of bone and increased bone formation in the spine, leading to bone fusion. In advanced cases, this can lead to spinal deformity. Ankylosing spondylitis most commonly occurs in men in their teens and 20s, but it can affect anyone of any age. It tends to be milder when it does occur in women, making it harder to diagnose. Drug treatments and physical therapy can help relieve symptoms. Symptoms. The three main symptoms of ankylosing spondylitis are pain, stiffness, loss of mobility. Pain is the main symptom, especially in the lower back and buttock areas during the early stages. However, inflammation and pain are not confined to the spine. It is a systemic condition, which means it can affect other parts of the body. This include other joints, the neck, the top of the shin bone in the lower leg, behind the heel of the foot, in the Achilles tendon, under the heel of the foot. Ankylosing spondylitis can cause so-called bony fusion, an overgrowth of bones at the joints. This can make it difficult to carry out everyday tasks. In some cases, it can restrict movement of the chest and make it hard to breathe. People with ankylosing spondylitis may also experience fatigue, a feeling of being tired and lacking energy. Ankylosing spondylitis can also affect the eyes, including the iris and other parts. This inflammation, known as iritis or uveitis, depending on the location, can cause redness and pain. It can impair vision if not treated. Other systemic signs of the disease may include neurological and cardiovascular changes. Causes. The exact cause of ankylosing spondylitis remains unclear, but the symptoms result from inflammation in parts of the lower spine. When new bone grows, this inflammation can lead to damage and fusion. The fusion can happen as a result of the inflammation of the tissues that connect to bones. However, it is not yet known why this chronic inflammatory process occurs in people with ankylosing spondylitis. The condition often runs in families and is known to have a genetic component. Diagnosis. A doctor will ask about symptoms, carry out a physical examination, and arrange for tests where necessary. If inflammatory back pain is present with certain features, this may indicate ankylosing spondylitis. The features include pain that does not improve with rest, pain that causes sleep disturbance, back pain that starts gradually before the age of 40 years and is not caused by injury, symptoms that persist for over 3 months, spinal stiffness in the mornings, which improves with exercise and motion. Imaging test may confirm the diagnosis, but changes may not be immediately visible on such test. This can delay diagnosis. Blood test. No blood test can confirm ankylosing spondylitis, but test can help confirm diagnosis and rule out other causes. The test for inflammation may include erythrocyte sedimentation rate or ESR, C-reactive protein CRP, complete blood count CBC, genetic test HLA-B27. If other causes such as rheumatoid arthritis are suspected, testing for rheumatoid factor or RF, cyclic citrulinated peptide or CCP and anti-nuclear antibodies ANA can help rule out these conditions. Imaging test. This may include X-rays, which can reveal both early and more advanced changes to the spine and pelvis. MRI. For example, an MRI of sacroiliac joints can reveal early signs of the condition. Exercises. Physical therapy and exercises can help prevent symptoms. A physical therapist will design a program that can help patients maintain good posture and motion in the joints. This might include daily exercises, special training, therapeutic exercises. Physical therapy exercises are referred to as strengthening exercises and range of motion exercises. Here are two exercises suggested by the UK charity versus arthritis. Number 1. Stand with your back and heels against a wall and push your head back to touch the wall. Do not tilt the head back. Hold for 5 seconds. Relax and repeat for up to 10 times. Number 2. Stand with the feet apart and hands on hips. Turn to one side. Hold for 5 seconds and relax. Repeat on the other side. Do this 5 times on each side. There are different ways to exercise, including water fitness. A doctor can recommend a suitable plan.